How to treat long-term COVID-19 symptoms and fatigue, easy self-remedies. Long COVID is a term to describe the effects of COVID-19 that continue for weeks or months beyond the initial illness. More research is being carried out into how best to define long COVID, what its symptoms are and how to treat it. Although most people who get COVID-19 recover quickly, for some the effects of the virus can last for weeks or months. This is known as long COVID. For some, it can seem like a cycle of improving for a time and then getting worse again. These long-term effects aren't only among those who needed to go to hospital, or even who felt seriously unwell when they first caught the virus. Research published in Nature Medicine in July 2022 suggests a wide range of potential symptoms of long COVID include fatigue, breathlessness or shortness of breath, difficulty sleeping, anxiety, depression or an inability to feel pleasure and enjoy things, heart palpitations, chest tightness or pain, joint or muscle pain, not being able to think straight or focus, brain fog, change to your sense of smell or taste, persistent cough, changes in skin and hair, including hair loss, nausea and vomiting, high temperature, bowel incontinence, erectile dysfunction, limb swelling, amnesia, hallucinations, difficulty with motor function or speech. According to the ONS, as of 2 July 2022, the most commonly reported long COVID symptoms were fatigue, 54%, shortness of breath, 31%, loss of smell, 23%, muscle ache, 22%. While this can feel worrying, it helps to know that heart palpitations are very common, even in people who aren't recovering from COVID, and are usually harmless. Changes to your heart rate can be caused by many things, such as dehydration, stress or anxiety, exercise, caffeine or new medications. In very few cases they may be caused by an abnormal heart rhythm. In some people with long COVID, heart palpitations may be caused by a problem with their autonomic nervous system, which controls things such as your heart rate, breathing and blood pressure. This condition is called postural orthostatic tachycardia syndrome, POTS. We don't know for sure how common this is among long COVID sufferers, but it may be a significant proportion of those who get palpitations or dizziness when they stand up. 1. Learn more about POTS and long COVID. When should I get medical attention? While palpitations are not usually a cause for concern, it's a good idea to get medical attention if you are worried about them, if the palpitations last a long time or are getting worse, or if you have a history of heart problems. Call 999 if you are experiencing palpitations or a faster heartbeat, and also have chest pain, dizziness or blackouts. Is it normal to have chest pain after COVID? Chest pain is a common symptom of COVID-19. Some people are experiencing chest pain that lasts beyond their initial COVID-19 infection, or that starts in the weeks after they've had the virus. It's important to remember that even if you have had COVID-19 and are now experiencing chest pain, it may not be related to the virus. If you experience any new type of chest pain, it's important to get medical advice, as chest pain can be a sign of something more serious, like a heart or lung problem. Is it normal to have back pain after COVID? As you continue to recover, many of these symptoms may also improve. You can aim for a balance of rest with as much of your normal daily activity you feel you can do, and also exercise to improve your strength and flexibility, such as stretches or yoga. Fatigue or breathlessness is preventing you from being active. You develop new symptoms. Tips for managing long COVID symptoms. Managing fatigue and breathlessness. Pace yourself. Plan what you're going to do and don't overexert yourself. Try to break tasks which feel difficult down into smaller chunks, and alternate easier and harder activities. Consider the best time of the day to do certain activities based on your energy levels. Frequent short rests are better than a few longer ones, so rest before you become exhausted. Don't stop doing things that make you feel breathless. If you stop using your muscles, they'll get weaker, which can make you more breathless when you try to use them. Try to gradually increase the amount of exercise you do. Try going for short walks or doing simple strength exercises and build up from there. If you use a walking stick or a frame, lean forward on it when you feel breathless. Boosting your mood and mental health. Be kind to yourself during your recovery, be prepared that some days will be worse than others. Connecting with other people can help you feel happier. Make sure to keep in touch with family and friends. Having a daily routine can be good for your mood and sense of stability. Stay active. Continuing to move will help release endorphins and improve your mood. Tips for dealing with brain fog, memory or thinking problems. Many people suffer from brain fog while recovering from long COVID. You may find it hard to concentrate or remember things, your thinking may be slower than usual, or you may feel fuzzy or forgetful. There are things you can do to manage the symptoms of brain fog. Make notes to help you remember things, whether it's in work meetings or medical appointments. It can help to make a clear plan before approaching any new or complicated problem or situation. Break it down into steps, and keep checking your plan as you follow it. Exercise, especially the kind that makes you breathe a bit faster and feel a bit warmer. Start gradually and don't overdo it. Check with your doctor before taking up a new exercise regime. Eat for your brain health. A Mediterranean diet including olive oil, fruits and vegetables, nuts and beans, and whole grains has been proven to improve thinking, memory, and brain health. Stick to the recommended alcohol limits or don't drink at all. Try to get as much sleep as you need. Read more about getting a good night's sleep. Try to do things that are known to stimulate the brain and also improve mental health, such as social activities, learning something new, and practicing mindfulness. Relieving joint or muscle pain. Flexibility exercises, like stretches, yoga and tai chi, and strength exercises, like climbing stairs, lifting weights and working with resistance bands, can be useful. Check with your doctor before starting a new exercise regime. What tests and treatments are there for long COVID? Is there a test for long COVID? There isn't one single test to diagnose long COVID. It's a condition that isn't fully understood yet. Speak to your doctor if you are experiencing lasting long COVID symptoms. They may refer you for tests to help understand how long COVID is affecting you and how it can be treated. Or it may even be that there is another cause for your symptoms. Tests could include blood tests, heart rate and blood pressure checks, a sit-to-stand test, an ECG, a chest X-ray. Researchers are looking into new ways to test for long COVID. Find out more about why researchers think findings about the immune system could unlock the way to a test for long COVID. Learn about a special MRI to better understand lung damage from long COVID. Is there a treatment for long COVID? Unfortunately, there isn't one single treatment or medication to treat long COVID. Everyone's experience is different, so it's important to chat to your GP about the symptoms you are experiencing. There's lots of things you can do at home to manage your symptoms as you recover. Read our tips for managing fatigue and breathlessness, low mood, memory problems, or joint pain. Supporting you to get the care you need. We know that many of you are experiencing delays to treatment at this time, or have questions and concerns about getting medical help. We've created this set of information to help you with these issues. Thanks for watching. Please like and subscribe.